Hi, I'm your host, Tuesday Addams. Welcome to Medical Monday. Today we'll be talking about menopause, understanding menopause, and the pros and cons of hormone replacement therapy. Okay, so menopause is when your body no longer makes periods and you're not able to have children. Okay. This is when you know your body's in menopause. This is when you no longer have a period for a whole year. Okay. Um, then your doctor can be sure that you're in menopause. Okay. And that's if you're not using birth control or taking any medications that stops you from having a period. So just your body all by itself, not making periods for a whole year. You're not able to have babies anymore. You're menopausal. Okay, so now there are some common misconceptions about menopause. And several of them are, sex sucks. There's no more sex in menopause. Your vagina is too dry and it feels like sandpaper. It's too rough. Women don't want to have sex, or they're hypersexual and they want to have sex all the time. And there's sleeplessness, night sweats, hot flashes, and that menopause is just awful in general. And emotional. Women are so emotional that they become a different person. Well, that's true in some cases, but not always. Generally, most women only suffer very few symptoms. And here I am, 53, and I'm 4 years deep in menopause, and I had no idea that there was even treatment for it. I had no idea. No one explained anything to me, and that's why I'm here for you today, and for my grandkids and for my children. I'm here for you today because I want you to understand. I would have loved to have somebody tell me what I was going through and what to expect, and what I can do about it. Yeah. Having sex feels like sandpaper. No, it's something I don't want to do, which is no different than I was at 33 years old. Okay, and I'm 53. Okay, it's just no different. There are hot flashes. I seem to have a little bit more energy than I did when I was having a period every month. I feel, I don't know, stronger than I ever have in my whole life. Yeah, I have hot flashes. I'm just now starting to have hot flashes. I've lost an inch out of my height due to calcium deficiency because estrogen, your body no longer makes estrogen when you're menopausal. And your body doesn't seem to hold your calcium. Even if you take vitamin D, your body just doesn't store it anymore. And my bones were hurting, my back and my legs and my feet and my hips, just awful. And I mean, my shoulder was kind of growing in and down like this, and nobody would tell me what was wrong. And I could see it in the x-rays. And I'm like, why aren't the doctors telling me the truth? Well, I have a calcium deficiency due to lack of estrogen. My body doesn't make estrogen anymore. So it's important for me to have hormone replacement therapy because I have lost an inch off my height, and osteoporosis runs in my family. My grandmother lost like 5 inches while she was in her aging process. And okay, so basically, the myths And the pros and cons of menopause and the pros and cons of hormone replacement therapy and the myths about menopause. We're going to first of all bust the myths, and then we're going to go into the pros and cons of hormone replacement therapy. Okay, the first myth is that, you know, menopause is awful. And that during menopause you might experience, it's that menopause is awful. You have no sex and, you know, sleeplessness, you know, you're sweaty, hot, emotional, and hot flashes. Just a big hot mess. Okay, well, that's not true. During menopause, you might experience anxiety, depression, you might have emotional or physical changes during sex or about sex related to sex. Okay. Might have memory problems. Okay. Sleep problems, urinary incontinence, which means that you can't hold your pee in. You might accidentally pee yourself when you're coughing like you're pregnant. You know, like you sneeze and you pee accidentally, or you walking and you pee. And I don't experience that, thank God. But you know, that is something I did experience during pregnancy, was incontinence. You just can't hold it in no matter what. That is something that runs in my family too. My grandmother experienced that. She experienced incontinence, and a lot of women do. Vaginal dryness, of course, and weight gain. Okay. Most women, though, have very minimal symptoms. Okay, so here I am 4 years deep into menopause, and I'm just now starting hormone replacement therapy. And the reason being is because of my calcium deficiency. Now, I just want to tell you that we will get into later the reasons why I didn't, because the pros outweighed the cons. Okay, but there are some cons to hormone replacement therapy, which is something you can do for menopause, so you don't have to just sit there and suffer. Okay, the second myth is that menopause never starts before 50 years old. Okay. Although 51 is the natural and normal age for a person for a woman to experience menopause, no, menopause can happen in your 40s. It's considered premenopausal or premature menopause when it's in your 30s. When you experience menopause in your 30s, that's considered early menopause or premature. And it can happen you can have premature or early menopause due to surgery. You can have a hysterectomy, and that will throw you right directly into menopause. Smoking can do it. Family history of early or premature menopause, or autoimmune disease. Autoimmune disease can also cause that. Myth number 3, nothing can be done to manage the symptoms of menopause. Well, of course, that's not true. We know there's hormone replacement therapy now, which it's been there this whole time. Okay. Menopause is a natural condition, and it doesn't naturally need or require medication or treatment. Your symptoms don't normally need treatment until later. Right away when you have menopause, you may not experience any symptoms, and you may be like, well, I don't really need anything. Well, that's fine. You know, you should have your doctor watch, though, your bone density, and be watching for things that are important that happen during menopause that you could prevent with the treatment of menopause. Yeah, if your symptoms are too severe, you don't have to suffer. Okay, that's the most important thing. If you're not suffering, that's great. Don't take any medications. That's great. Myth number 4, hormone replacement therapy is dangerous. Okay, this is where we're getting into the pros and cons of hormone replacement therapy. Estrogen and progesterone are the 2 hormones that your body stops producing during menopause. Okay, so if you are older than 60 and in menopause, or you are less than 10 years in menopause, menopause only lasts for about 10 years, and this is just your body getting used to being in menopause, being a menopausal woman, being a woman that is not able to have children. So usually it's 10 years. But if it's less than 10 years and you are not 60 years old yet, hormone replacement therapy might be a good idea for you, or a good choice. But for it can help with hot flashes and vaginal discomfort, but can also do a whole lot more than that. Okay. Women's Health Institute, the Women's Health Institute, Initiative. Okay. The Women's Health Initiative released a study in 2002 that scared women half to death. It caused a big, huge scare because it stated that hormone replacement therapy was actually bad for you and dangerous, that it increased your risk of getting breast cancer. And since then, though, that particular study breast cancer and heart disease, and it can increase breast cancer and heart disease, is what the study said. But since then, though, those findings have been reconsidered, and the studies have been debated since then. And they have found that actually the truth is that hormone replacement therapy can reduce your risk of breast cancer and heart disease. And heart disease. Okay. And it helps to fight bone tissue loss, osteoporosis, stroke, and heart attack. Okay, and this is the findings, the newest findings. Since 2002 and the big, huge scare, women didn't want to participate in the hormone replacement therapy program for menopausal women because, they felt like they were going to have a higher risk of getting breast cancer or having heart disease. But that's not true. In some cases, it might be true, but not in all cases. Most of the time, hormone replacement therapy helps your body to absorb calcium, which is very important in an older woman's body, so that you don't lose bone tissue. And that's so important. The most important thing, and the reason, the deciding factor for me was that reason, because I've lost an inch just in a year. In my height due to the calcium deficiency in my body because of the lack of estrogen. So I decided to start hormone replacement therapy because of that reason alone. Now, if you have a history of if you have a family history of heart attack, liver disease, stroke, or blood clots, you might want to ask your doctor about the risks of taking hormone replacement therapy. But it does help the estrogen and progesterone in your system helps your body to absorb the calcium that you take. So that's one of the most important factors that and the reason why I do take hormone replacement therapy. My bones were hurting, my back was hurting, everything is hurting, and I'm not as bad. And I just started this hormone replacement therapy not too long ago. It's been 2 weeks. And I'm already starting to feel better. The results are, you can see results in 3 weeks, usually in a couple days, sometimes in a couple days. I feel a lot better. Um, Naturally, I do feel irritable, okay, and I am on an antidepressant as well. And normally they only give you gabapentin for that. That's your treatment for menopause. I won't take that because um, it bothers my muscular nerves. I have Tourette's or dystonia where it causes me to make movements that I can't, or do things that make sounds and that I can't control, like Tourette's or dystonias. And so I don't take gabapentin because it makes it worse instead of better, and it's supposed to make it better, but in my body it makes it worse. So okay, so not all women have that risk, of heart attack and stroke, and and since then they have found out, the studies are that no, it doesn't actually increase. In some it may, but not in all women. It does not always increase your risk of breast cancer. So that was my issue with the hormone replacement therapy, because I was smoking at the time. I was talking to my doctor about it. I do not smoke anymore. And I've been trying to quit for a few years, and I keep going back to vaping, and then something always happens to where my my finances do not permit me to purchase to be able to afford a vape. And so I have to do the crazy thing and buy cigarettes. And I do have patches, but it's really hard. The patches do not absorb in my body that well, and it doesn't seem to work that quickly. I do tend to still crave cigarettes, and it's so hard for me when I'm craving a cigarette, and then to be in menopause as well and be so irritable, it's just hard. So she recommended that I do not take hormone replacement therapy. Well, since then, I quit smoking, and I seated my women's health physician who put me on hormone replacement therapy. And I've been on it for 2 weeks, and I'm happy, and I do not regret it whatsoever. I feel like I'm still irritable. But I just started taking my antidepressants again this week, so it's only been a couple days. But once that levels out, I feel like there's nothing that I can't do. I feel like I made the right decision, the right choice, and I want you to be aware that there are things that you can do and when you become menopausal, and that it's not the worst thing on the earth. Yeah, I do have hot flashes. I just recently started having hot flashes, but I've been sleepless for a long time. I wake up at 3 a.m. every morning, almost between 3 and 5 every single day, and I'm completely happy with that. I get up, I make coffee, and I'm up all day long, and I don't take naps. But my irritability and the bone tissue loss was the important deciding factors. It was the most bothersome symptoms for me during menopause. Everything else is bearable. I can deal with it. But my bone tissue loss, the calcium deficiency, was basically my deciding factor because estrogen helps you absorb and keeps the calcium in your system. And you can overload. It can overload your body with calcium. So you don't want to take too much, and you don't want to take calcium supplements on top of it. So, you know, you just want to keep your eye on that. Hormone replacement therapy can also help with okay, so the clogging the with your lessening your cholesterol and triglycerides also, and it helps fight dementia. And my grandmother had dementia, so these are the things that I have to, so I have a family history of those diseases. I have to look at all these things and make my decisions wisely. And it does help fight and reduce your risk of dementia and high cholesterol, heart disease, and stroke. Some of them can increase. Okay, it just depends on your body and your family history. And also, you know, you have to, you know, count in other factors too, as well as, you know, eating healthy and eating right, and, you know, just, you know, exercising daily. So, but this is the reason why I did choose to. My cholesterol was extremely high, and you know, so. You know, estrogen and progesterone can help with that. That is one of the studies. That is one of the disputes with the study, with the Women's Health Initiative, with their study that was released in 2002. There's been debates that hormone replacement therapy can reduce your risk of you know, breast cancer, heart attack, and stroke. But you shouldn't take it for that sole reason. Don't, you know, I read somewhere where, you know, if you are a man or whatever, or a woman, and you're not menopausal, don't take it to reduce your risk of stroke or heart attack. Okay, because it's not good for you. It has been known to cause calcium to be overdosed in calcium as well. So, yeah, watch your doses, and there's your pros and cons. And that's everything that I wanted to say. That's everything. So, I'm Tuesday Addams. I'm your host. This is Medical Monday. It's the first Monday of every month. And I told you I was going to do this for you, and I did it for you, and I would have loved for somebody to do that for me. So have a great day, have a great week, have a great month. I love you. Bye.